I'm Dr. Daniel Kantor, Neurology in Real Time. I'm joined here by Dr. Sam Hunter from Franklin, Tennessee, who is the president of Advanced Neurosciences Institute. You're standing in front of a poster that I know well, but people back home may not know that much about. What were we looking at in this poster?
So we looked at what you do with the hardest MS patients, the people who failed multiple therapies, who have a lot of disability, who are very limited. And we took what's considered to be the most effective MS therapy. It's also one of the hardest used therapies, and we treated them repeatedly over many years. And we repeated the experiment after a number of years to see if we'd get the same results with people who've been treated with newer therapies. And what we found is that virtually everybody has an opportunity to improve. And these are people, some of whom even need canes, but people who didn't need canes had a very good chance of improving. And what we see is that improvement can be delayed. It can be delayed for years, but if you continue to use aggressive treatment, they have a chance to improve. And so about 80% of people improve, and largely people either improve or they get worse. And since most of them improve, you can see this benefit of improvement over time in disability scores. And what's really powerful is that if your disability stays the same for years, your future has improved. Your future isn't changed. You move to a different course of loss of function in MS. And so what we've seen is two things that we didn't expect to see. First of all, we've always been told that people who are really bad can't get better and shouldn't be treated, and that's clearly false. The other thing we see is that it takes a great deal of patience and very aggressive treatment to achieve improvement, and that the whole concept that MS degeneration in disability is something that's not controllable looks like it's not completely the case. That there is room for some people to modify their disease with current disease-modifying therapies to get some improvement in disability. This kind of delayed improvement is a kind of a repair in the brain, and it's clearly elicited by manipulating the immune system and consistently trying to control disease activity. And even though the disease activity doesn't go away, people still have relapses, they can still have MRI activity, they can be improving in disability.
So these are people that for years, Dr. Hunter, you've been talking about how despite the fact that they have a lot of relapses and a lot of disability, there is hope. And by using our most powerful medication, we really can help these people. Now the Food and Drug Administration has also talked about it. The FDA has talked about the idea of active secondary progressive MS. These people have what we would call active secondary progressive MS. And here we had with our most powerful medication, with a medication called Alemtuzumab, we had better results than we've seen with any of our other medications.
Well, I think that that's exactly correct, and we call these people secondary progressive MS with relapses. It's the same, it's an equivalent designation, and even the people that are relapsing this trial, people don't spend long once they start getting worse at lower disability. They very quickly get very limited, whether we think it was a part of a regressive component or it's because of the number of relapses they have. But either way they got there, it looks like they have the potential to improve.
Dr. Hunter, thank you for standing there and fighting for the people that need it the most. And I want to thank you for joining us yet again. And I want to thank all of you for joining us with Real Time Neurology.